Hi, welcome back to my channel. Today I'm going to talk to you about transferable skills that you as a pharmacist possess that's highly valued in non-traditional roles. These are skills that you use every day when you dispense a medication and your other duties that you have. So here's number one, your clinical knowledge and expertise. You as a pharmacist, you're highly educated, you have all the medication knowledge, you know drug safety, you know efficacy, you know drug interactions. This is highly valuable, as you can imagine, in a role like in medical affairs or regulatory affairs, where you can use this knowledge in these roles where it's highly valued. Number two, communication. You communicate with patients and healthcare professionals on a daily basis. Your ability to take highly scientific information and present it in ways so patients can understand or engage in highly scientific interactions with healthcare professionals can be used in a job, say, as a medical science liaison, where you're doing that on a regular basis. Number three, attention to detail. Again, dispensing medication, you have to be very accurate, very specific, make sure there are no mistakes. You can use these skills in a role like in compliance or in policy or pharmaceutical law. All of these different areas where attention to detail is important. Number four, your problem solving and critical thinking skill. When you are working in the pharmacy, you're always solving problems, right? Whether it's operations or figuring out the best medication route for a patient. All these different skills can be applied in different roles in like a healthcare organization or a pharmaceutical company is putting together a big patient support program. These skills can definitely apply. Next, leadership and management. Many of you are leaders in your current traditional role. If you're able to lead groups of people, you can lead in other roles as well. You can lead operations. So that leadership and management skill can transfer over to almost anything that you think about doing. Regulatory knowledge, right? You have a complete understanding of the FDA and regulatory bodies and how they govern how you practice pharmacy right now. So those skills can be applied in different areas such as regulatory affairs and helping your clients in consulting understand how the FDA works and how these standards and guidelines apply to their day-to-day lives. Patient centered care. Because you are a pharmacist, you are a healthcare professional. So, patient is always number one in your mind. So, you can actually apply those same skill set and that mindset to a role in patient advocacy, where you're working with a different healthcare organization or even within the industry, in the corporate, in developing patient centered pieces. So, that's always a skill that can be used. Like, okay, what would the patient think? How would the patient interpret that? Right? And last but not least, project management. You know, you manage a lot of things in these pharmacies. I know, I remember doing that, right? So if it's a high volume pharmacy, you have all these different pieces moving. You can apply those skills to almost any non traditional role. Maybe you can lead a project in a pharmaceutical company, or maybe you can work in a patient support program, put it together, manage all those pieces, the call center, all of these things. So I just wanted you to know and understand that as a pharmacist, you already have these skills that will be highly valued in a non-traditional role. So when you're thinking about, is this really something that I can do? It is. Trust me, it is. And the good news is I'm here to help you, guide you through that process. So please check my website out, subscribe to my page, and we can start this journey together.